Hi, I'm Sarah, and I'm going to be talking about aplastic anemia for my informative speech. Aplastic anemia is a bone marrow failure. For those of you who do not know what bone marrow creates our white cells, our red cells, and our platelets. Our red cells carry oxygen to the body, our platelets clot cuts, and our white cells help fight infection. The most common white cell that is affected by aplastic anemia is our neutrophils, which fight bacteria. And our lymphocytes are actually not normally affected when diagnosed with aplastic anemia. Aplastic anemia is a rare diagnosis. Most people generally get diagnosed with leukemia before getting diagnosed with aplastic anemia. Because it is so rare, it's about a 1 in a million chance that you could be diagnosed with aplastic anemia. I know Children's Hospital in Boston only receives about 4 patients on a really bad year. The only ways to diagnose aplastic anemia besides a complete blood count is a bone marrow aspiration and biopsy. When they do the biopsy, they actually look at the cellularity in the marrow. So for someone who's 20 years old, you want about 80% cellularity. At 30 years old, you want about 70% cellularity. For someone with aplastic anemia, your cellularity is about half or more of what it should be. For more serious cases, it's generally below 15% or more. And it just means that your body can't keep up with production at all, leading you to need blood transfusions, platelet transfusions, being on isolation, needing to wear masks and gloves, not being allowed to go to public, kind of interfering with a lot of normal life. Aplastic anemia also makes it really hard to work because you don't have enough red cells pumping oxygen all throughout your body. You become easily fatigued and easily tired, and there's so much that you think you can do and can't do. Like, you wouldn't be able to get up off a couch and go to the bathroom and come back without being completely out of breath. The reasons why I know that is because I've been there. Um, the only treatment right now for aplastic anemia is immunosuppressive therapy. It is when you are held in the hospital for about a week and you receive a drug called ATG. It is an anti-thymus globulin, and what it does is it actually attacks your thymus, which holds a lot of your lymphocytes. It's kind of the school center for your lymphocytes, and it teaches your lymphocytes how to be white blood cells, because the theory is aplastic anemia is an autoimmune disorder. So the only way to fix that is by introducing a drug that's going to wipe out those blood cells that aren't doing what they're supposed to be doing. So after you receive it for about a week, you also go on to pills called cyclosporin or sometimes Sandimmune, some kind of immunosuppressant pill that you can take at home. And that generally goes for a course of a year. Most people see improvement within 3 to 6 months, but 30% of those people will not see improvement. And 30% of the people who do see improvement will relapse. There's a very high relapse rate with aplastic anemia, unfortunately. Again, I know because I've been there. Once you relapse, your next option is bone marrow transplant if it wasn't your first option. And the only way it's your first option is if you have a matched sibling. And to find a matched sibling is really, really hard. Only about 25% chance that one of our siblings will match us. So you have a really great chance if you have 4 other siblings, because you have about maybe 100% chance that one of those siblings are going to match you. But other than that, the chances are slim, and they tell you not to get your hopes up. Most people go on to the donor registry and look for matches. You don't do that yourself. The hospital does it for you as they prepare you for a bone marrow transplant, which is, right now, the only cure for aplastic anemia. And even that will lead you it will leave you with a lot of other issues, unfortunately, but it's something that you weigh the options out. So they kind of condition you beforehand, or at least that's what they call it, with chemo and radiation. And the goal of that is to kind of wipe out any of the bone marrow that, well, what little bone marrow that you have that's producing not so great of stuff, just in case it decides to try and make a comeback and attack the new marrow. So what our bodies basically do is it clears out that marrow, so we don't have an immune system, we don't have a way of producing blood or white cells, and we are stuck in the hospital for 30 days or more, generally, after receiving chemo and radiation. They harvest the marrow after they find a donor. The donor remains anonymous for up to a year or 2 years, depending on if they're out of the country. My donor was out of the country, so I will not get to meet him until January next year. People with aplastic anemia also need actual bone marrow. And the bone marrow process is when they actually stick a needle into your back hips and they do little notches and they suck the marrow out. And then they bring it to the hospital that the patient's at that needs it, cleans it, and whatnot. It doesn't have to be the same blood type. All that matters is that the HLA typing is correct and close enough, and generally you want a 10 out of 10 match. And HLA typing is, it's almost like typing your DNA. It's proteins that are found on the DNA that you want to match with the donor. And the closer the match, the better the chance of no rejection, no graft versus host disease, and other issues that can arise from a bone marrow transplant. So that is a lot of the information about aplastic anemia. Some people end up actually going into remission with just ATG, and it's really beautiful, and they stay in remission for the rest of their lives. Though they can never, ever be considered cured, they're aplastic anemia free. And I currently am aplastic anemia free. I'm cured of aplastic anemia. But, as I said before, other issues come along with transplants, especially with aplastic anemia patients. We tend to be a little bit more special and end up having other issues in the end. But nothing that won't get in the way of a normal life. I got lots of my information from Children's Hospital, but if you would like to find out more information for yourself, you can go to aamds.org, and it can tell you about aplastic anemia and other bone marrow failures and what you can do to help. You can also go to bethematch.org, and yeah, so that's my informative speech on aplastic anemia, and I hope that I have given you some great information and that you understand it a lot better. I know that it's a lot to comprehend and let sink in because it is a lot of information, but yeah, so have a great night.